Hello, today we'll be presenting control strategies for HIV infected systems. HIV, or human immunodeficiency virus, attacks certain types of the cell in the human body, primarily the CD4 plus T helper 1 lymphocytes. The main function of Th1 is to help the activity of other immune cells, particularly in the adaptive immune system, including the activation of the antigen-specific CD8 plus cytotoxic T lymphocytes, or CTL. CTL acts by recognizing the viral antigen being presented by the viral cells, then eliciting cytotoxic immune response. For example, through disruption of the infected cell, or cytolysis. The figure shows the central role of Th1 in mediating adaptive immune response against HIV and how it activates CTL to destroy the infected cell. As we can see in the figure, primary HIV infection causes a decline in Th1 activity, which is then followed by an increase in viral load within 6 to 9 weeks of infection, which is called acute HIV syndrome. An immune response to HIV then ensues, with a decrease in detectable viral load. However, a period of clinical latency follows, during which Th1 cell counts continue to decrease. When Th1 counts fall below 200 cells per cubic millimeter, the person is diagnosed with AIDS. AIDS patients have an increased risk of opportunistic infections, which rarely affect people who have normal working immune systems. Recently, HAART, or highly active antiretroviral therapy, has been successful in reducing the AIDS-related death and complications. HAART consists of multiple drugs that act on different viral targets. Treating a newly infected person using HAART will rapidly reduce initial bursts of virus replication and preserve Th1 cell population. However, it lessens the intensity of CTL response, thus creating an incomplete immune response. Therefore, some researchers have proposed the idea of structured treatment interruption, or STI. This strategy is based on the idea that periodic and transient increases in the viral load might re-stimulate the waning HIV-specific CTL response. And as the figure shows, this approach is most effective when performed during the primary infection instead of the chronic infection. Ideally, we would want to choose a treatment strategy that either eliminates the virus from the system or upon completion of therapy enables the system to be self-sustaining. While this may not be possible in practice, our approach seeks to reach these ends. Mathematically, the optimization of a treatment strategy can be phrased as maximization or minimization of a functional. In the continuous case, this takes the form of an integral, while the discrete case is a sum. The methods for studying these problems is known as the calculus of variations. While we have now seen the form of our objective function, we still need a technique for actually achieving the goal. We will now discuss two possible strategies, using an sample system to indicate the strengths and weaknesses of each approach. If we consider the figure below, we see a diagram representing the possible steady states of our model. If there is no noise, we expect the system to approach a steady state and remain there. However, by adding in noise, we see that the system may leave the state with some probability. In either case, we can influence the state of the system by varying important parameters. By doing this, we can push the system into a desired state or even remove the unwanted steady states entirely through bifurcations. Here we have a system of ODEs representing an HIV-infected system, where X is the healthy T cells, Y is the infected T cells, Z1 is the helper-independent CTL, W is the CTL precursors, Z2 is the helper-dependent CTL. We also have a parameter u that can only be 0 or 1. U represents the amount of treatment, and u equals 0 is no treatment, and u equals 1 is when we apply the treatment. For this system, there are two steady states, one healthy and one unhealthy. The healthy steady state depends on you, so we cannot simply treat the person for some time and then stop the treatment. We have to drive the system to the steady state with u equals 0. We also restrict ourselves to change u only once a week, assuming that a person attends a doctor and takes tests no often than once a week. For this problem, we approach the problem with a bang-bang strategy, also known as switch control. That is, we either have full treatment or no treatment every week. While we only choose one strategy per week, we use a finite horizon objective that selects the optimal strategy over the coming 6 weeks. Our objective function balances the amount of treatment used with the proximity of the system to the desired steady state. The true optimal strategy is easily found using an exhaustive search. As we will see, repeated application of the strategy will allow us to drive the system away from an unhealthy steady state and into a state where the immune system can regulate itself. Numerical integration is done in MATLAB using the Adams-Bashforth-2 method, which is an explicit time differencing scheme that has second-order accuracy in time. The resulting parameter versus time dependence is shown in the top left figure. All figures here use a semi-log scale. In order to investigate how robust our model is, we introduce noise in the weekly measured parameters. With noise, treatment can be resumed even when the system is close to the desired steady state, as you can see in the top right figure. With bigger noise, the length of treatment period increases, as you can see in the bottom left figure. Finally, we extend our results by considering 3 different possibilities for the treatment, which include u equals 0, 1/2, and 1. The result is shown in the bottom right figure, where solid curves correspond to the 3 possibilities case and a dash to the 2 possibilities case. We found out that with 3 possibilities, we need slightly more time for treatment, although all the variables converge to the steady state much factors. The same result can be achieved by adjusting weights in the objective function. In addition, we can describe the system with discrete numbers of each type of cell using a stochastic model. Here, we use a tile-leaping approximation to the Gillespie algorithm to propagate the system forward in time. We note that for large numbers of cells, the stochastic model approaches the behavior of the deterministic system described in the previous slide. Thus, the control strategy is able to approach the same steady state. However, for lower numbers of cells, we see that the system can be completely cleared of virus, allowing for the system to reach a truly healthy steady state. This indicates a potential way of clearing the virus early in the infection period. We move to another system of ODEs, representing an HIV infected system. Here, T is equal to the healthy T cells, T star is equal to the latently infected T cells, T double star is equal to the actively infected T cells, and V is the viral load. Here, U represents the level of chemotherapy that the patient received. U can vary continuously from 0 to 1, where 0 represents full treatment and 1 represents no treatment. As stated earlier, for continuous control, objective functions are stated in terms of an integral. Here we aim to find a u of t that maximizes our objective function. Specifically, we will use Euler-Lagrange equations to find u of t that maximizes our objective function. We will also see that our steady states depend on U of t. The problem can be solved by constructing a Lagrangian from the integrand of our objective function. In the formulation shown here, we introduce 4 Lagrange multipliers that can be manipulated to solve our problem. We also use 2 penalization functions to ensure the solution remains in the desired range. While it will not be discussed in much detail here, this optimization problem can be rephrased as solving a coupled system of 8 differential equations, including the 4 state equations of our system and the 4 equations shown here. We can think of this as a boundary value problem, which we solve numerically in MATLAB. We can see that when the level of treatment is high, or when U is relatively small, the only steady state is when the T cells remain at a healthy level of T cells. Only when we lower the level of treatment past a certain threshold that we will see the infection begin to take hold, and the system will be driven to an unhealthy state. In the absence of treatment, the system enters an unhealthy state. As we can see here, the natural progression reaches this steady state after approximately 6 years of infection. In order to avoid this fate, we designed a 500-day treatment that decreases a viral load and keeps the population of healthy T cells at normal levels. As shown here, our computed optimal control is rather effective at helping the system proceed to a safe, although unstable state. Due to the penalization for using treatment in our objective function, we find that the optimal plan is quite different from that being used in the bang-bang control problem that was discussed earlier. It is worth noting that a final condition for our problem is the completion of treatment. Unfortunately, the instability of the healthy steady state means that without further treatment, there will eventually be progression of the disease. That is, we find that continued treatment will be necessary for the duration of the patient's life. This final project was created for the 495 Analyzing Biology course at Northwestern. I hope you all enjoyed it. Thank you for listening.